Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk this morning to you about use of this Big Daddy arch wire, this large arch wire that we have. You can get all the lateral expansion you ever want out of that. I mean, it is powerful enough to expand anybody's arch. And you can, with the orthodontics thing we have today, this is straight wise orthodontics. We use this large arch wire all the time for many things. And it's kind of hard for some people to understand that this should not be used if you use it, if you're expanding a lot. You have to have a rectangular wire in the teeth and put buccal root torque in the rectangular wire, and then you put the Big Daddy wire. It has positive torque, but it expands laterally, and it will overpower the torque you put in the rectangular wire. And then to get people to understand that if you torque rectangular wire and put it in the tooth to do the buccal root torque, the root runs into the cortical bone up here, and the crown is down in the air. Instead of you getting buccal root torque, we're talking about a tooth now, and we're putting the wire in like that. Instead of you getting this type of arch, the root of the tooth goes up against the bone, and it just doesn't go, and the crown is in the air, so you get lingual crown torque if you put just a rectangular wire in there and put this progressive torque that I'm going to show you about. So I want to show you the skeleton and see what you're working with first, and then we'll go in and show you how to do the arch wire itself. So I'm going to kind of get here and show you the skeleton. Now this is a real skeleton, and you can't buy them now, but I bought this about 50 years ago, and I don't know who they were made for, who made them, but they came off of a human being, and they take them and work on them for a long time to get this out. Now this bone here is cortical bone. Now that covers the whole teeth down here, but you don't see it on here. They cut it away so you can see the cancellous bone. Now this is soft bone structure here. And when you put buccal root torque, and as you try to bring the roots out like this, they run into this cortical bone that's out here, and the crown actually moves toward the tongue more than this will move out here. The torque overpowers the lateral expansion of the arch wire itself. So you have to have a large wire to make sure the force comes out. And we're going to hammer that in, and I hope that you'll understand that. I'm going to show you several short shots of the skull and to show you that. Now this is the tooth up here, a big blown up side. This is cortical bone, it's hard bone. This is cancellous bone here. And this is on both sides of the teeth. And if you try to push the roots of this tooth out, the crown moves to the inside, and that's opposite of what you want. The arch wire doesn't have enough lateral force pulling it in this direction. That's coming out toward you. It goes lingual in there. Now I'm going to run through a whole bunch of these pictures and make sure you understand what you're dealing with here. Now here's another cutaway, and this is a human bone. This is soft bone here, there's all sorts of things develop in your blood vessels are made in this area. And the body uses all of this. And this is softer bone, and the tooth will move to the lingual in there and try to go out here, and your crown will actually go the other direction if you don't have something strong going to the outside. And this is just another view showing the roots of the teeth in this cancellous bone right here. Now every tooth has a lining in there of fibers. This gingians are little fibers. They go from the tooth to the bone, and those periodontal membrane in there, the tooth has a give to it. When you bite on it, it gives a little bit. It has those, it's held up by these tiny fibers in here. And when you start to move one, and you put pressure against those fibers, the body moves the bone as the tooth moves. It moves over, and you can move the tooth. As long as a person is alive, you can move them. And I don't know why they came up with the idea that you couldn't move adults' teeth. This is a ridiculous way of looking at orthodontics. Say, when you get 18 or 19 or 20 years old, your teeth don't move, and the rest of your life they don't. They move all your life, whatever you want them to do. So understand, now coming in from the bottom, you have a nerve. This is the artery, and you have a vein coming out, and you have a lymph vessel goes in and supplies the nerve inside the tooth in here. All this you're dealing with too. Now, as you get older, I remember when my father, I did a crown on my father when he was about 75 or somewhere between there and 80, and he didn't need an anesthetic. My teeth were extremely sensitive while I was growing up, but now I can have a tooth filled. The nerve canal is filled up with calcium and is blocked out anymore, and I don't really get any feeling. They can go in and work on the teeth, and I don't feel them working other than just the jarring of something going on in there. So that's something to learn about teeth too. Now let's get some other. This is the terminates now, and these are covered with soft tissue and gingians of little fibers that stick out in here, and those fibers stay moist all the time. You go to sleep at night and you're breathing through your mouth, in about 15 minutes your mouth gets dry and it doesn't filter out anything, and you breathe in the junk. If you breathe through your nose, it stays moist all the time, and the stuff gets caught in here, and you may suck it into your mouth and spit it out, or you may swallow it. It doesn't bother your stomach. The acid kills most of everything that you breathe in. And so it's, but if you have this air go in without that, you pull that junk down into your lungs, and that does bother you. That gives you a lot of trouble. So you've got to, these things are filled up with this deal. If you're got an allergy, this will swell and it'll close your airway here. It closes that area up, and now you have to breathe through your mouth. You can't go without breathing, and there's a difference in how much you breathe through your mouth and how much you breathe through your nose. Now, I breathe through my nose good while I'm setting up, but when I lay down, I seem to breathe through my mouth. And so I have a little of this problem myself. Now let's go on to some other pictures here and give you, to learn what you're dealing with, learn about the anatomy of the teeth. Now this is the septum between the nose on each side of the nose. Now sometimes this septum will be deviated. You get hit in the nose and it rolls back and it'll close one side more than it does the other side, and you can't breathe up one side as good as the other side. And if you understand this nasal septum down between here and here, that terminates. There are 3 terminates in here. Now sometimes the terminates are big that they almost close this. And I think my assistant one time, one of my best assistants, had a breathing problem, and she finally got the ENT guy to come in and reduce the size of the terminates so that there was more room there to breathe. Now if we look over the inside, you have cortical bone up in the roof of the mouth, but it's not as hard as the cortical bone on the outside. And the tooth will move in like that, and the crown will move over against the softer bone, and the tooth will go the wrong way. Now, everybody has their teeth. There's more bone in the anterior between the teeth out here. Excuse me. When you get old, you have to cough. Everything. But we put the palatal separator in here, and it's spreading these teeth apart here down on the bottom, and we're pushing it apart. And they said, well, you can't separate the palate over 17 or something like that. You just won't go. So I came out here and put spring out here and working with this area, and we could separate the palate then on people in their 30s and some in their 40s, not too many in their 40s, but you can expand anybody's mouth. After they get where they won't separate, you just continue soft pressure in there, and you can spread anybody's palate out. And I'm going to show you how we do that. Now let's go on to some more. So that's the end of the bony structure. Now I want to come in and show you what you have to do with the doing the Big Daddy arch. I'm going to draw this off. I'm going to erase that, and then it'll put up a white screen here. Now I'm going to draw the teeth, or try to draw them, and this will be the upper teeth. We go up something like this, and this is the lower teeth. Normally the upper teeth fit over the lower teeth, and the lower teeth come up in like that. And the tooth, this tooth keeps the cheek from coming into the in between the teeth, and you keep your chewing it. Now I'm going to come over on the other side, and we'll draw the upper teeth again. And we'll draw the lower teeth. Normally the lower tooth would be coming in like this. Now the upper one has 3 roots. It has a root coming out in the middle here too. Now, if we breathe through our mouth, the tongue rests between the lower teeth right here. And it's how much you breathe through the mouth, and everybody would be different. Now, Dr. Harvold, years ago, took a whole bunch of rhesus monkeys that would be about the age of a kid, maybe 10 or 12 years old, and he stopped up the noses of these rhesus monkeys, and every one of those monkeys developed a malocclusion. They weren't all alike, but they're just like people. In other words, you stop the nose, some of them breathe through the mouth one way, and some of them breathe another way, but none of them could get air through their noses, so their faces developed wrong. So they're like your tongue goes down here when you breathe through your mouth, the air goes through this area up above. So you've got the roof of the mouth up here, and it goes over the tongue, and the tongue stays down here too much. Well, the tongue widens this out, and after a while, my teeth do the same thing right here. You'd have I'm going to draw the tooth down here, the upper and the lower tooth, and the pressure on the tongue moves the tooth out, but it doesn't move the upper tooth, it moves the lower tooth out. And people will get the lower tooth then will come out and hit like this. And now the cheek can get in there. That's the way mine are. Sometimes I have to get food up in here to hold the cheek away to keep from biting my cheek here. It'd be the same way on the opposite side over here. Well, a lot of times people are biting like this. Instead of actually doing that, they'll shift the teeth over. They'll shift the jaw over. I'm going to draw this over here now. This will be the lower, and this will be the upper, coming down, hitting like this. And this is not good chewing, so people will move their jaw to one side, and it makes the teeth, then these teeth will go in here, and these over here will go over the other side, and people will have a crossbite on one side of their mouth. And some people, both of them go out like that, and their crossbite will be on both sides. In other words, the upper teeth fit inside the lower teeth on both sides. So we have a bilateral crossbite. And that's the way these crossbites occur. And if you're going to do orthodontics, you need to understand how people chew and do that. Now, if they chew over to that side, the condyle or the jaw will move to one side, so they get the cusp go down in between here, and they'll get it where the cusp up here is at like that, and the buccal cusp will be out on one side, and it'll be in on the other side. And they chew that way from one side or the other. Then the condyles have to change back here over a period of time. And you'll have the condyles, you can feel them right in front of your ear. If you just put your finger up there, wiggle back and forth. Now, I want to show how we do these arches. To do the, like you take a tooth like this. Now, we'll have to erase this a little bit right here, and I don't know if I can erase it, but we have a slot in the tooth that goes out straight like that, and you have a bracket on it. It's a little better drawn than that. And if you want these roots to go out in this direction, you have my way of understanding which way you want it to go. If you say, this is the tooth, the upper tooth. Now I'm just showing. And we do progressive root torque. In other words, you spin this. What you want to happen up here is this tooth to turn this way. In other words, you want it to move out in this direction. All right. Then we put torque in there. In other words, we tilt it like this. And the arch wire goes out, and then it bends all the way back here. Now what we do, I'm going to have to draw the arch wire down here, I guess, to show you. Well, and you bend the ups like that, and you you hold this wire here where the power pliers right behind the cuspid, and you twist this 90 degrees or more until where this wire going in through the bicuspids then will start putting this buccal root torque into that wire. And when you get out here, the end of it's going straight up and down. Now take this wire and you bend it like this and slip it into this slot here, and it has more torque on the molars than it has on the bicuspids. And that's where you grab the wire back at the bicuspid, hold it, twist that other around to where it stays out about 90 degrees. Now you twist that wire. In other words, you watch what I'm doing. This is hard for people to understand. You twist that wire, put it in here, and it'll tend to move the roots out that way. But the bone is in, tooth is in hard bone right outside, so the roots move over a little bit. I mean, they start to go this way, like that, but the torquing force does the lateral force of this wire. You could have it straight, but it still doesn't have much force on it. So instead of doing that, the crown moves lingual. Well, you have to use the two wires together. We put the buccal root torque in a rectangular wire. In other words, the rectangular wire getting back to the molar would be going up almost straight up like this. And you bend it down and then stick it. No, I'm sorry. It goes down like this. You see, it comes down. You bend it up, stick it in the slot right here, and it tends to move the roots this way. But it would move the crown the other way if you did come in here with this large wire. It has all kind of lateral force, and you pull that in and hook it to this, and then it will carry the tooth out bodily. You watch the tooth and see if this separates down here. If it separates at the bottom like this, you've got too much of the buccal force from this tooth. If it does the other way, you carry it straight, and you bring the teeth out parallel like that. In other words, normally, if you just put one of these in there, the crowns will go the wrong way. They'll go in instead of going out. And so you put this large wire, and I use an 040 round wire or an 036, and some people use an 030 wire to do the lateral expansion. And you can expand anybody's arch. I don't care how old they are, what nationality they are, what color their skin, anything else. With the system I have developed over about 60 years, and they say that you can't move the adult's teeth. This is a big mistake. People's skeletons change all their life. You look at somebody when they're 17 or 18 and look what they look like when they get 50 or 60 years old. Their body moves out, they get fat, get overweight, they move to take care of the weight that the person has in there. So this is something you need to understand. I'm going to go back now and erase this whole thing and put back up and show you again on the arch wire. Let's just say we're going to put an upper arch in right here, and we would do this wire. The wire would go back like that. Now I can't draw it coming out, so I'm going to draw it in this direction. And you're going to reach behind the cuspid tooth. Normally you don't torque it. And you grab this with a pair of pliers right here and hold it, and you bend this until let's just say, this is the wire right here, and you bend it till you have twisted this all the way around like that. And now this arch wire will start out with a torque start over here just flat. When you get over here, it'd just be like that. It'd be up and down like this. And now, if we take that wire and pick it up, put it in there, and it goes that way. And then your big wire forces it to keep going this way, so you've got torque going here and torque and pressure going here. So we got a positive torque on the bottom and a negative torque, which is in here on the top. Now down, if we got bottom teeth, if the bottom teeth, and we want to root the roots out like this, we want the roots to go with the crown, then your torque is completely opposite from what the upper one is. And this gets people confused. And I even had me confused there a minute ago. I was talking about torque being like that. So you're going to have to say, what torque does it take to break the roots of these teeth out? We're going to have to torque it up in this direction right here. So we would catch it, and this one would be up, and you bend it down, slide it in there, and it tends to bring the roots out, but the crown would move in. But then we put the big wire in there, it won't let the roots go, it won't let the crown go in, and you have pressure going both ways. And so the teeth will move out bodily that way. And this is something people have a hard time understanding. You show them this big wire, you can expand anything you want, and they put it on and don't put anything else on, and it widens it out. One of our best men, instructors, had this mixed up. He was trying to torque the teeth with a big wire right here. You can't torque with a round wire. Well, you can do positive torquing. You can bring them out this way. Now, if you made the big wire too small, on the inside of here, you pull the tooth in, you could pull it in that way. But we put everything outside. So we've got the rectangular wire going in this slot, and it would be, if we're doing an upper one like this, you have to have the wire with torque this way. We bend the wire, stick it in here, and it's twisted, and it pushes this tooth out in that direction. And then you put this large wire out here, and it won't let the crown go in, so it brings the crown out, and this rectangular one brings the root out at the same time. And if you're going to use this large arch wire, then learn how to do that. And it's hard for even some good people I know think they'll just put the one wire in and do it. It's not. You have to have a rectangular wire if you're going to widen an arch very much at all. Now, if your teeth were leaning in like this, and you could put it on, and you wouldn't have to do that. But it's you want to bring the teeth out like this. And now, if you bring the roots out, you're going to come back and you will widen the airway. In other words, if you bring that tooth out bodily, this is all going to spread in this direction, see? And that'll give the terminates more room, and it will help you person breathe better. And that's the secret of it, is you've got to get people breathing right, or they're going to have problems. Just like all those monkeys, they couldn't breathe through their nose, so every one of them developed a malocclusion, but it wasn't the same with every one because they didn't react the same way. So this is something you've got to understand if you're going to do this complicated orthodontics, and I want to just pass that on to you. And I hope you're able to understand, and this goes out all over the world, and people need to know that. You can make any adult's arch, you can expand the adult or children the same way, and going in here. Now, you could, if you use that to expand, you don't put much force up here, but as you expand the arch, the teeth go back, they back up as they expand, if the arch doesn't come apart. Now, if you're separated with a palate will separate, you separate it, and you pull them, they go this way. But if you expand with the Big Daddy and everything, they go out like that, and they move back in. I hope that people understand that and want to do orthodontics like what we call the straight wise system. You can move the teeth any direction that you want to. As far as I can figure out, there's no direction you can't move the teeth. I can move them up and down, move them sideways. I can move one side out, move both sides one way or the other way. You can move it every way there is to do it with this straight wire system. And it is something I just added on to straight wire. And I wasn't using their brackets, and I was teaching it. A lawyer sent me and said I had to stop calling my system straight wire. I wasn't using their brackets. I did use a straight wire bracket from somebody else doing the same thing. And so I called it straight wires. And we did that years ago. And now if you want this to go that way and you want to do the complicated stuff we do, learn how to use this Big Daddy arch wire along with a rectangular wire. So I'm going to hush on that, but this is hard for people to understand. And some good people just don't seem to grab on to that normally. So you do buccal root torque, and then you use crown torque with the big wire, bringing it out. Don't let the crown go in, go out, and now you'll carry the teeth out like this, and that spreads this out, and that gives you more airway than you had. And these people that breathe through the mouth, their airway doesn't develop properly, and they have too small, and it gets worse as you get older. So I have to thank you for watching, and I hope you watch our channel. We've got 3 channels in YouTube, and Facebook is covered up too, and you can study these videos, and I've tried to cover everything I can think about related to orthodontics, from the temporomandibular joint to everything you could do to the teeth here that I could come up with. And remember, I'm sure there's something I haven't been able to cover, but I've got nearly 1,000 videos out here that covered nearly everything in orthodontics. So thanks for watching, and don't just do it yourself. Teach other people how to do. I get people writing in all the time saying, well, I want that done. I take it to my orthodontist, and he tells me, well, my teeth don't move after so-and-so and this. Show the orthodontist how we move those teeth. They've been taught that they can't move them, but you can move your teeth as long as you live. And I'll stand on that. It is absolute fact. And so I'm going to say goodbye for the evening for this time, and we'll come back. So thanks for watching, and I'll close out on that. Bye-bye.